that's what entertainment is nowadays.
Yeah.
So this is a better right atrium right here. You guys all see that? Okay. Right atrium. You can tell because here's the tricuspid valve.
Great.
And so when the blood comes in, this valve will be closed. Okay. So the blood comes in here, and let's see. Yes. Well, so it comes into the right ventricle. Okay, so this is right here. So it comes through the tricuspid valve. A couple things to note here. You can see the chordae tendineae. These little things. Those actually attach the valve to the heart wall.
Okay.
Okay. Because when the valve closes, if it didn't have those, it would just flap the other way. That's what happens with a heart murmur.
With the backflow?
You get some backflow, yeah. Okay. And so this is where the this is where the pulmonary artery is. Okay, you see that? So this is the ventricle. This area right here. See, I just opened up the ventricle. So you can think of it like your bladders. You know, bladders that contract and expand and push liquid in and out. So it goes through the pulmonary similar valve, which is this thing right here. See that? So it goes out. This is pulmonary artery. Okay, so the blood follows that way. Goes to the lungs, goes through all that stuff, and then it comes back into the left atrium, which is right here. Okay.
Right.
And again, you can see that this is the mitral valve. I call it mitral valve because it's mitral, which has an L in it, which is on the left side.
Left side. Okay.
And tricuspid has an R, which is on the right side. Okay, so I would accept bicuspid or mitral valve. Okay. And also, you can see here the papillary muscles, which are at the base of the chordae tendineae. Right here. Can you see that? Okay. And then the trabeculae carneae is going to be kind of these little folds down here. You can see it. This is trabeculae carneae too. Okay.
So would this be what you just mentioned, the base?
So this is the chordae tendineae, which is this.
Okay.
This white stuff.
And the
Papillary. Yeah, papillary is this thing.
Okay.
This thing. So the papillary attaches to the chordae tendineae.
Oh, okay.
Okay. And the trabeculae carneae is sort of a superficial feature of the inner heart wall, which is kind of this stuff. Okay, so the blood is in the left atrium.
Yes.
Okay, and it goes through the mitral valve. Okay,
Yeah.
so that opens up. This atrium pushes the fluid down in here. Okay, so then the left ventricle fills, and the reason this heart muscle is so big is because that has to pump the blood to the systemic flow throughout your whole body.
Your whole
arms,
body.
your head, everything. Except the lungs, of course. Okay, and then so when that ventricle pumps and reduces the volume, then it goes out, and here's your aortic similar valve.
Yeah.
See that one? That valve right there. It's a separate flap.
Okay.
See that?
Is it the flap?
It's the flap right here. You can see how it's been kind of sliced at a weird angle. You can probably see some more of it right there. There's some more of it. You see that? Yeah. You all see that?
Yeah.
So that's the aortic similar valve, and this is the aorta. Okay, so
Which is the aorta?
this thing.
Oh, the big. Okay. Turn it over
And then
again.
you
Let me
can
see. Yeah.
See that? And again, you can poke that through. Poke that through the. So that's the heart should look like that. So I think that's the. What was first? The brachiocephalic? No, that's the left subclavian. That one. That's the. You don't have to know those, but just to tie things together, you know.
Cool.
But that's the arch, and that'll go out and then go down the body.
Yeah.
You have like just pins on there. You can access like how it flows through, the air flows through, or
Yeah. How is that going to be set up?
it's like
I could see something like when the blood flows from the right atrium to the right ventricle, what valve does it flow past?
And that would be tricuspid.
Yeah, on the right side. Or like what valve does the blood pass through when it exits the right ventricle?
The pulmonary semilunar. Yeah. That's lecture stuff.
stuff
Yeah,
again.
that's lecture
No,
stuff.
that's okay. I mean, that's why we're here.
yeah.
Yeah, and then it comes in into the left atrium. And like I said, if you know that flow chart really well,
I remember.
And once you can-
Yeah, me
I just have to
too.
I just have to write it out and then I'll get it.
yeah, and once you find the left ventricle, like I showed
be
you at
able
the
to find
beginning,
everything.
yeah, so once you find this, if you know that whole thing.
The only thing I was worried about is getting confused is when you have both sides of it out. I might like, I don't know.
Yeah, but again, like if you see both sides, You see how easy it is to see that left ventricle?
Yeah, true.
Yeah, I mean that's
Yeah.
it's really pretty easy. I mean, sometimes they might cut like too much of the bag, so you can see how this isn't much of the ventricle here, but this
Okay.
is most of the ventricle right here, right there.
Okay.
But it just depends on how they cut it. So if they cut it right there, it would be more on this side.
Okay.
But again, the first thing to look for is the thick and hard wall. Just drill that into your head. Look for the thick and hard wall.
I have a question. What is this hole right there? Is that the beginning of the don't tell me, mitral? Where the blood will be pumped through the mitral?
yeah.
Okay.
Yeah.
Just checking out. See that? Okay. Yeah.
And remember, the trabecular carinae are only in the ventricles.
Only in the
You
ventricle.
don't have to know the pectinate on the pig model, but you do on this one.
Okay.
Okay. So
And
the
what-
pectinate's only in the atrium. Make sure you note that. So this would be a pectinate muscle with that star.
Pectinate muscle is the star.
Star. Blue star.
Yeah, blue star.
So is that 3-valve thing? Is that the tricuspid valve again?
Yeah.
Except on the
That's the right atrium.
Wait, what is the star?
That's the pectinate muscles.
Pectinate muscles. That's
what's the function?
What's that?
The function? Do we have to know like stuff like that? No.
That's just a
That's for lecture.
Oh, okay.
yeah.
Just for lecture. All right. Signing off.
YouTube.